Ankylosing spondylitis is an autoimmune disease which affects the joints, and it usually starts in the hip joint and then spreads over to the other joints also, like the spine and the shoulders, the knees, the ankle. All other joints also may get affected. In this, the vertebrae in the spine can start getting fused, and over a period of time the spine can have a hunch. In the sense, the person can have a hunch over several years. This usually starts off in early adulthood, like in the 20s or maybe even before the 20s, and it progresses gradually, leading to a hunchback. You must have seen some people having a hunchback. Once the fusion has completely happened and the vertebrae is fused, it's very difficult to reverse the condition. The earlier we start a treatment for this, the faster we can help the patient to relieve symptoms like pain and inflammation and progression of the disease. I've seen that the patients, even with a hunch, if we are on homeopathic medicines, the progression of the disease can be halted. To reverse the hunching will be very difficult because fusion is a structural change. Once calcium deposits and it fuses, it's little difficult to reverse, though there are cases where there may be an improvement subsequently. But the chances of it reversing is lesser once the fusion happens. So the earlier we start, the better it is. Like we can see in some of our patients that they have progressively improved after homeopathic treatment. Their requirement for painkiller will reduce. So the side effects of using a painkiller won't be there when you are on homeopathic treatment.
Hello, Mr. Sridhar.
Hello, sir.
So, you've been taking our treatment for what problem?
Yeah, so I am having this ankylosing spondylitis. It's a kind of rheumatic disease that I have. So I'm taking the medicine from you for this problem.
When was it diagnosed? When this problem was diagnosed for you?
So it was made up 2023. In July, I had this extreme pain in my hip joints and my thigh areas.
Okay.
So I talked to a doctor, and ankylosing spondylitis was diagnosed. And I came to you in probably in September or October 2023. And since then I have been taking this medicine.
Before you came to us, like what was your usage of the allopathic medicines, like painkillers or anything you were using? Any medicine?
Yeah. So I was under the treatment of an allopathic doctor, and he prescribed me this non-steroid anti-inflammatory drugs or the painkillers. So I was taking twice a day, and for a couple of months or maybe 3 months. So for 3 months I was taking 2 painkillers each day, and then luckily or unluckily I got this viral hepatitis. So I had to stop the painkiller. So I was searching for some alternate, and I got to know that you were treating this ankylosing spondylitis, and I came to visit you.
Okay.
And since then I have been taking these medicines.
Okay. So after you started medicine, like how much time it took for you to get some relief?
Yeah, initially I was on strict diet and also on the medicine, and it reduced within a month or a couple of months. It reduced, and I also got the treatment for the viral hepatitis pneumonia, and after that that part was resolved. The hepatitis part was resolved. Then I started to take my regular meals, including the glutens and sugars, but in a reduced amount. But I was on my regular meals, and I continued with the medicine, and the pain was under control only.
Okay. Now it's been about 2 years or 1 year since.
Yeah, more than 1.5 years almost. Yeah.
So in the past 1.5 years, how many times you must have used the painkillers?
Yeah, so I can remember I just took 2 painkillers in this 16 or 18 months that I'm
On medication?
on medication.
So otherwise you were symptomatically feeling weak with the pain and all?
Yeah. So pain-wise I am ready, and sometimes there are some mild flares, not that much painful like previous. but this is a chronic disease, so there will be some flare-ups. But you gave me this SOS, which I use during my flare-ups, and I will say it has been reduced drastically.
So without using any painkillers, using just the homeopathic medication, you are able to manage the situation without much pain. And had to use only painkillers twice overall in this past 18 months. And your hepatitis issue is also resolved.
And also I'd like to highlight that another symptom of this ankylosing spondylitis is extreme tiredness, the fatigue. So the fatigue was there when I was in under this painkiller treatment. But since I've been using this medication, homeopathy medication, that part has also changed a lot. So I'm not that much tired nowadays, and I am able to continue my work. So that is another thing that helped me.
Okay, that's very nice, and I'm very happy you are improving well.
Yes, sir.
And I pray that you get better completely, and you're out of this issue. Okay.
Thank you, sir.